Ever freeze up when a patient asks about cost? You're not alone. We weren't trained to talk about money, but your patients still need the truth.
We have these other things that can help. And then allow them to use their value system, their pain points to make that decision.
Want the language that builds trust and converts? Stay tuned.
Hi, this is
Hi,
Carlos
Brenda.
from Canada.
Yes.
Hi. Yeah, no, see, this has been a great topic, and really nice to be able to listen to you and all the great ideas that you have. And I think it's just more like sometimes it's really hard to often get out of our head. That part of marketing and that part of money when you're talking to patients, realizing that, you're offering something that has a value to, but we're scared to talk to patient about that. But also we're scared about what other people think, that, you're pushing too much of this great, amazing therapy. But I think it's like AI, orthobiologics are here to stay. And we have to get on the wagon, we have to make it work. And here in Canada it's a little bit harder because I live in a small town. I do actually family medicine. I do a couple of sport medicine. I'm on a pain clinic. I had created MSK pain clinic. So it's a little bit different setting. I just started like a few months ago. And I started offering P about, I would say 2 months ago. And I had like only a few patients. And, I'm really stuck in that sense of, just bring it to the attention of patients, because I do cortisone and steroid injection as well. And a steroid, people don't have to pay here for that.
Don't forget, if you want more about the business of orthobiologics, I have a podcast, or you can go on my website, The Business of Orthobiologics, and tune in.
So of course they prefer that, but now I started to tell them, like, we might be damaging now the cartilage more, and you're advancing your osteoarthritis with these injections. This is a better option. This is, of course, unfortunately one that you have to pay, but it's just more about breaking that barrier, the mental barrier from the doctor.
Let me stop you there, because you did something that I'm going to urge you to hold back on. The word unfortunately is not what we want to tell them. Unfortunately, you have to pay for it. Let's flip that. Mm-hmm. Fortunately, we have a treatment that doesn't cause damage to your cartilage, doesn't raise your blood sugar, doesn't cause osteoporosis, doesn't accelerate your arthritis. Isn't that lucky?
Excellent.
Right? So please, when words can be very powerful when used in the right context. So when we use negative connotation words, we want to say, well, unfortunately, your coverage doesn't cover this. Luckily, we have something that is so good and so powerful, and it's low downtime, and it achieves your goals. And don't assign value. Canada does have some limitations. Obviously, you can provide PRP. Carlos, you have a pain clinic, an MSK pain clinic. You have 1 billion patients sitting there waiting for you to tell them what to do, to show them alternatives. Nobody wants surgery. Nobody really wants cortisone. They like the quick effect, but if they knew the other risks, and so we've done a poor job of telling people the risks of cortisone, because when you tell them, because I tell them in my clinic, hey, listen, you have all these options, cortisone, which we don't recommend because of the detriments, hyaluronic acid, platelet-rich plasma, cellular therapy. Now in Canada, cellular therapy is not something that the government is actually allowing yet, hopefully soon. Ultimately, you can use that. Unfortunately, cortisone damages you. On the flip side, we have these other things that can help. And then allow them to use their value system, their pain points to make that decision. And say, hey, what questions do you have? How can I help you achieve your goals? Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us.